Imagine one day you wake up and you start hearing voices in your head that are constantly yelling at you. You no longer care about how you look or feel, and all you want to do is lay in bed. Soon, so much time has passed that you don't even know the day or year. This is the reality for those that have schizophrenia. Today, I will portray the serious of schizophrenia. I am credible because I have done hours of research in 3 of my classes. We will be analyzing schizophrenia by learning about the causes, risk factors, and complications, looking at the symptoms, and researching the treatment options that are available. First, we will be looking at the causes, risk factors, and complications. Schizophrenia is a disease for the brain, and problems with naturally occurring brain chemicals like dopamine and glutamate occur. If this happens, there's an increase in getting schizophrenia. Furthermore, not is it only genetic, but it is also, as Mayo Clinic says, a combination of genetics, brain chemistry, and environment that contributes to the development of the disorder. Now, we will be looking at the risk factors and complications. The risk factors include if you have a history of schizophrenia in your family. Next, if there is a complication when you were born. This includes malnutrition or exposures to viruses that may impact brain development. And 3, if you take mind-altering drugs during your high school or teen years. Now we will look at the complications. This includes suicidal thoughts, depression, inability to work or attend school, financial problems, and much more. Next, we will look at the symptoms that mainly occur when one has schizophrenia. These all come from Mayo Clinic. First, the 2 main symptoms are delusions and hallucinations. Delusions are false beliefs that are not based in reality, and hallucinations are hearing or seeing things that do not exist. These seem very real to the person experiencing it. 2 more symptoms include disorganized thinking and unable to perform daily functions. Disorganized thinking results in disorganized speech. Answers to questions may be partially or incompletely unrelated. They are very ineffective at communication. Next, inability to perform daily functions include the lack of hygiene or lack of emotions. They do not seem to care about showering or doing personal hygiene, as well as they avoid eye contact and they have a very monotone voice. Here is a visual aid of some of the main symptoms of schizophrenia. It includes hallucinations, delusions, disorganized speech, reduced speech, flattened affect, and lack of initiative. All of these are very common symptoms for people that have schizophrenia. Lastly, we will be looking at some of the treatment options available for those that have schizophrenia. The main treatment option is a drug called clozapine. Here are some pros and warning signs, as well as side effects for clozapine. As the National Alliance of Mental Illness says, clozapine rebalances dopamine and serotonin to improve thinking and mood behavior. It also is approved to reduce the risk of recurring suicidal thoughts in people with schizophrenia. A long-term effect is if one stops taking clozapine, this may improve their chance of symptoms to relapse. So once you start taking it, constantly continue to take it. Now for some side effects of clozapine. For pregnant women in the 3rd trimester, it is not recommended to take it because withdrawal from the baby could be a main symptoms. These could include agitation, feeding disorders, and respiratory distress. Other side effects include lower high blood pressure, insomnia, vertigo, dizziness, nausea, and increased heart rate. On the rare case, decreased white blood cells, inflammation of the heart muscle, and seizures may occur. In conclusion, by analyzing the causes, effects, risk factors, and complications of schizophrenia, looking at the symptoms, and finding treatment options, we now know how serious this disease is. According to the SARDAA, 3.5 people in the United States currently have schizophrenia, and 50% of those diagnosed have received no treatment at all. Thank you. Don't stop.